Hello, Jennifer.
Hello.
We're about 5 months after your surgery, which was a bit of a special surgery.
Yes.
It was not only the classic FFS techniques, but we also did advancement of both upper and lower jaw because you had a bit of a dished-in face. I have a few questions. The first one is, what problems did you have that made you have this surgery?
It was more sort of internal problems because I think the first issue I had is I went to, this is the first thing I remember, is I went to change clothes in a changing room and I sort of caught my profile in the mirror and it was absolutely horrible because it didn't matter what way I turned my head. It was just this massive lower jaw, massive chin sticking out. And it sort of drove me to the point where I would not want to look in the mirror at all anymore. So I tried to avoid it. And if I did, I would be looking straight on. I would never try and go sideways because I could just feel it there. It was absolutely horrible. So I knew I had to do something about it.
Yeah. What was the reason you came to us for that surgery?
Well, I'd looked online and seen, I did a fair bit of research for it. And it was between yourselves and the facial team. But I also spoke to some people in a support group that won, and they had experience with yourself. And they said that the care and the results they got from you were a lot better than they got elsewhere, or noticed elsewhere, so that's a quite good indicator for me.
And about your result, what do you think of it?
Well, obviously, immediately after, it was still quite swollen, and it's that point where you look in and you think, what have I done? But as soon as the swelling started going down, like I said, I'd taken the picture I sent you originally, the one for the simulation, and I'd kept that on my phone, and then a couple of weeks after the surgery I took another one that's pretty similar, and the difference was just incredible. It was just crazy. It's just a totally different profile. It was a totally different side.
Yeah. Your passing has improved?
It has, yeah. It's not before, it's something I was focusing on all the time, but I feel like I don't have to anymore. So
you're more relaxed.
Yes, it makes it a lot less effort. It makes it a lot, like before you'd be walking about sort of panicking, thinking, what's this person thinking, what's that person thinking? Now I'm just able just to go about and not have to think about it, which is great.
Yeah, great. Can you tell us a little bit more about the recovery of this surgery and also about your stay in the guest house and how safe you felt or not safe?
I don't really remember much of the stay in the guest house. I don't think I was the best patient. I had somebody keeping me company, which was good, but everyone there was really, really friendly. I didn't feel like I was ever left by myself. I felt like if I ever had a question, I could go and ask. I did spend a lot of time recovering in bed because obviously it was quite an intensive surgery, so it wasn't really painful, but it was painful at some times, but the painkillers managed it. But it was more quite uncomfortable, not being able to eat, and the recovery was more sort of psychological than physical. I did not expect it to be that difficult, but that might just be me. When I got back home, again, it was manageable pain for the first week or so, but the biggest problem I had was not being able to eat solid food. Soup diets were killing me after a while, and when I finally got to move on to solid foods, it went a lot better from there. I managed to get a lot more energy back, and I was able to get out and about a lot more, so that really helped. Overall, it was not as bad as I thought it was going to be. I was able to go back. I booked off 6 weeks from work because I get Christmas off anyway, and I wasn't required to take any additional time. I was able to go back to work and perform. I probably could have gone back like 2 weeks earlier, but I used the extra 2 weeks just to recover a little bit extra. So,
no. If you could give yourself, as you were before the surgery, give an advice, would you have one, and what would the advice be?
I would tell myself to go for it sooner, to be honest.
Yeah.
Yeah. I held off because I thought, well, maybe things would get better, but it didn't really. But yeah, I have no regrets at all.
That's good to hear. The last question: if someone that is interested in having surgery with us would like to get in contact with you by email, is that okay?
Yeah, that's fine.
That's very nice.
I've actually spoken to a few people who, obviously you won't be able to say who they are, but I've actually spoken to a few people who I believe might have had surgery with you recently with something very similar to me, because I came across them online and they were looking for people with experience. I reached out and sort of gave them my advice from how I felt. So hopefully they are recovering well.
Yeah. Well, thank you very much for the interview.
You're welcome.